Hi, I'm Kelly, back with North Shore Eye Care, and I'm sitting with Dr. Martin right now. He's going to talk to us a little bit about LASIK. Could you explain to us what LASIK surgery is for patients that don't already know?
Sure. So LASIK is a way that we correct vision. So people that are nearsighted, farsighted, or people with astigmatism are able to get out of their glasses and contact lenses. This is something we've been doing for almost 20 years, and it's been greatly successful, a very fun part of our practice.
Can anyone have LASIK?
Well, that's a great question. So you have to have certain qualifications to have LASIK, and these are the things that we figure out on a LASIK evaluation. So on a LASIK evaluation that's complimentary here at North Shore Eye Care, we test your vision, we look at your corneal map, we talk to you about any possible medical problems. There's an age requirement. You have to be at least 18 years of age, but sometimes we would wait a little longer in a situation where a prescription wasn't stable. And we just basically want to make sure that you're otherwise healthy, that the only problems in your eye are that they're nearsighted, farsighted, or also astigmatism. I'll explain what those are in a second. And that you understand what you're going to get. Your expectations can be met. So some people that might not be a good candidate for LASIK are people with thin corneas or irregular corneas or high prescriptions, or people with other pathologies such as diabetic retinopathy or cataracts. Those patients might not have LASIK. Just to speak a little bit about it, nearsightedness, people are always confused about what that means. Nearsightedness, these are the people that need glasses for distance. So they need them to see far away. Typically it happens 10 to 15 years of age it starts. With farsightedness, these are the patients that start needing reading glasses at around 40, but then also need distance glasses around 50. Presbyopia, just to be even more confusing, is a process that when you get into your 40s, you just need reading glasses, but you never need the distance. And then astigmatism, which we also correct with LASIK, is a condition where an image is split into a line. So basically with astigmatism, your cornea, instead of being shaped like a basketball, is more shaped like a football. And those are the things we correct with laser vision correction. So I tell people that this is basically for the under 60 crew that want to get rid of their glasses but are otherwise healthy.
Okay, so it won't help people who just need reading glasses.
No, well, a lot of people that just need reading glasses also have some distance correction, have astigmatism or otherwise. But people like myself, for instance, I have 20/20 vision. I'm 46 years of age. So over the last few years, I started to notice that I need some glasses for reading. And for me, it wouldn't help because if I corrected my vision for reading, I would then need distance correction, and it's not worth the trade.
Okay. Just out of curiosity, when did you start with North Shore Eye Care?
So North Shore Eye Care has a rich history. The practice was started in 1962 by my father, with my mother as his only employee. And
Right.
there were no offices in Smithtown at that time, so they rented an apartment on the west side of Smithtown, and that's where they lived and worked, and that's where it all got started. I joined in 1997 when the practice was around for quite some time, and Dr. Zweibel and my dad were the only two ophthalmologists. We practiced at a tiny little 2-exam room practice on the west side of Smithtown, and the whole office was about 1,000 square feet. And today, we're in 8-location, large practice with 16 or 17 doctors. It's really grown into something special. And I've been able to manage the practice through that as the managing partner. So it's been a lot of fun because I've always had a passion not just for the clinical results of LASIK and cataract surgery, but also for the management of a business, which I really enjoy.
One of the things I love is when patients come in and they talk about, remembering your father and back in the day. So it's nice to be part of that. Just out of curiosity also, do you remember the first LASIK case that you ever did? When was it too?
Well, that's a great question. So when I was in training, when I was in residency at a hospital in Nassau County, when LASIK first came on the scene. So an interesting story is I got into ophthalmology not knowing anything about LASIK or laser vision correction. It wasn't around. So I chose this profession based on a field that was mainly taking care of the elderly, cataracts and
Mhm.
such, there was no laser vision correction. So when I was a second-year resident, the first laser came to Long Island in Nassau County. It was 20/20 laser centers. And I was fortunate enough to have two excellent mentors, Dr. Eric Donenfeld and Dr. Alex Hatzis. And what they allowed the residents to do is to essentially do procedures for half price at the hospital because I wasn't accepting any fees, so they just wanted the
Right.
facility fee in their respective facilities.
Right.
So I basically got them to give me a price that I could bring to the hospital employees, and that's exactly what I did. So I spent the whole second year of my training going around the hospital that I was training at and telling everybody that I could give them super cheap LASIK. And amazing to me, it just shows you how much people value their eyes, which is crazy, but many, many of them took it. So that's how I got trained in LASIK, by offering half-price LASIK at the training hospital that I was working at, and it worked great. So when I graduated residency, I had already done 150 cases, and it's funny because last week I was at a dinner where we were lecturing on dry eye or something to local optometrists, and one of the optometrists came up to me from Nassau County and told me how I ruined his practice back then because I took all the patients that he was trying to do get LASIK, be a part of the
Mhm.
deal that I was getting them all at bargain rate prices, and it was true. And I apologize, but I was training, and when you're training, you're very selfish in your intentions.
You want to get the experience.